Good afternoon. Welcome to the Sunday briefing of the St. Clair County EMA office, where Sam Bierman from the Health Department is here with some more better numbers, and we'll have questions and answers a little bit later.
Yes, always excited about question and answer day. As you said, our numbers are looking really good today. As of today, 80,512 St. Clair County residents have been tested, which is an increase of 567 from yesterday. We are at 69,890 positive test results, which is an increase of 22 from yesterday. And that does include both males and females from under the age of 10 up to their 60s. Today, our daily county positivity rate is 3.9%. For negative results, we are at 73,523, announcing no new additional deaths today, so we are still at 184. And for those who have completed the IDPH required 10-day isolation period, we are at 6,332. For state totals, 5,105,153 have been tested, with 274,258 positive test results, which is an increase of 1,402 from yesterday. For deaths, the state is reporting 8,450, which is an increase of 14 from yesterday. For hospitalization numbers that are for hospitals that reside in St. Clair County, currently we are at 45 individuals that are admitted due to COVID-related reasons, and 3 of those individuals are on ventilators. Regionally, our numbers for patients that are admitted due to COVID-related reasons is 76, and we have 7 of those individuals on ventilators. Happy to report that we have no new changes to our congregate living facilities that are in outbreak today, so that's always a good day, along with some good numbers. And now I will turn it over to Chairman Kern for his update.
Great, Sam. Thank you. We'll move into the zip code report. Remember, these are changes in the zip codes. They're all positive, additional positives today that we're adding, and these are cumulative since we began this 191 days ago. So in 62201, we go up 1 to 235. 62204, we go up 1 to 138. 62205, we go up 3 to 198. 62207, we go up 1 to 243. 62208, we go up 2 to 420. 62220, we go up 14 today. Sorry, Mom, to 555. 62221, we go up 2 to 660. 62223, we go up 10 to 408. 62226, we go up 4 to 719. 62239 goes up 1 to 100. 62243 goes up 1 to 107. 62254 goes up 1 to 258. And 62269 goes up 2 to 546. So our daily county positivity today, and this is with St. Clair County numbers. These are the most accurate numbers that you can get. They're very timely. They're put together each day. Our county positivity today is 3.9%. And we haven't seen that for quite some time. The 7-day rolling average is 5.7%. So this now is our 4th day rolling average beneath 6.5%. And we've been using that and holding 6.5 as a benchmark to be able to get back to dining indoors and having our liquor establishments indoors also. So we'll be making the case and working on that. With that 5.7, congratulations, Team St. Clair. The state has our numbers today, the regional positivity, at 7.5%. And that's derived by the fact that they have Bond at 5.1%, Clinton at 11.1%, Madison at 7.5%, Monroe County at 3.9%, Randolph County at 1.5%, St. Clair they have today at 5.3%, and Washington County they have at 22.2%. So once again, that regional positivity number that the state puts together, they have us at 7.5% today. Herb?
The numbers are looking good, and we keep our fingers crossed that they keep that way. Sam, did we have new test sites this coming up week? By any chance? We want to make sure that everybody's.
On Tuesday, September 22nd, we have the Marissa Mackey Community Center, which is from 10 a.m. to 12 p.m. and then from 1 p.m. to 3 p.m. And then on both Thursday and Friday this coming week at Moody Park in Fairview Heights, 8 a.m. to 4 p.m. each day, and that is at 525 South Ruby Lane in Fairview Heights.
Very good. And is there another one?
Yeah, we
Brian?
also have one coming up, we're sharing it this evening on our Facebook, Monday, Tuesday, and Wednesday, IDPH returning to the Fairmont City Community Center,
Okay.
so,
So
in
those,
the East Side Health District there.
those will be posted up, and I think there's one of them coming up that's going to be evening hours in
The Fairmont City is
Madison, yeah.
1 p.m. to 7 p.m. each day.
Right, so we'll have them posted up to where everybody can see that and take advantage of that. And as always, on Sunday is our question and answer day, so Brian, if you would, questions, please.
Yeah. Sam, first one that came in here for the health department says, I see that we have had 48 new cases in long-term care centers this week. Since we do not know if it's residents only or employees, is there any way to track the difference? My concern is that if employees of them are spreading outside of the nursing home. I know that Clinton County has reported cases as residents or employees. Why are we not doing them separately?
So we report by zip code. So when a long-term care facility would test, and if they had any positive test results, let's say there were 5 positive test results, that would be attributed to the zip code where that facility is. And then each day, we announce if there's any new changes to our long-term care facility, whether that's staff or residents. And if, let's say, I'm just gonna pick my zip code that I live in, 62221. If there was a long-term care facility there and we announced 5 cases that were in that facility and they all went to that zip code, the chances would be that those would be individuals that were residents of that facility.
So people can monitor their zip code, that's why we read them every day to say, hey, in 62220, much to my mom's chagrin, they went up by 14 today. That kind of gives you some indication that in that zip code, you know that there is a certain amount of spread going on.
Yes.
Okay. The next one says, my college-age daughter tested positive for COVID. In the days leading up to the test, we shared a drink as well as spent lots of time together. Neither myself, my husband, her roommate, or her boyfriend tested positive. If the virus is so contagious, then how is it possible that one of us didn't catch it from her?
So that could really be situationally dependent. It could have depended on the time frame that you were exposed to her versus the time frame when she was shedding the virus. So you need to take that into account, as well as it's possible that you could have been exposed to that virus and your body was just able to fight it off and that you never had any symptoms. And please keep in mind too that the day that you were tested is a snapshot for that single day. So there's a variety of reasons why someone would not contract COVID if they were exposed to someone. So we have to really look at it on an individual basis.
The next few are all very much alike, so I'm going to try and bunch these together. Lots of questions about the numbers and stuff we've talked about here before, but kind of need to reiterate about how some people are seeing the state's numbers aren't necessarily matching what we're reporting, and then controversy regarding BJC Hospital and their numbers.
So every day when we start our day, we are getting results from different facilities. We get them by email, we get them by fax. Some are auto-generated reports that we receive. We take all of those results and our staff, we go through them to make sure that, number one, they're not double counted, that we're not counting the same person's test result twice. And then we also have some of our health department staff members that they call all of our long-term care facilities each day to see if they've had any new positives or negatives or deaths. And when we get all those numbers compiled, we take those, and that's what we report here on the EMA briefing every day. And we've said it before, we take great pride in the fact that the numbers that we report for St. Clair County are as absolutely accurate that we can get. We know that we are reporting the most up-to-date numbers for results that we do every day.
You're bringing in data from a lot of different labs. I mean, there aren't just 1 or 2 different labs that are doing business in this county and testing people in this county. I don't know, there are at least 20 labs, I would think, that are doing testing, and every day you're getting those results in. And then you also get a report in from the state. Every report, of course, has names and addresses. So you're able to match up names, addresses, positives, negatives, so you know that exact number right here, and we always have had that number. St. Clair County numbers, and we've always said it, it's the most up-to-date, accurate number you can get. So you can count on the fact that when Sam says the daily county positivity day is 3.9%, that's what it is. And we've done that and kept track of our own numbers, because if you look at how the state gathers their numbers, they're always 10 days to 2 weeks behind. And we took it upon ourselves, and Herb Simmons, we said that if we're going to deal with this virus, we got to know what's happening yesterday and today to be able to do timely maneuvers, whether it are additional restrictions or hey, we need to get the word out, or we need to get masks to this particular area of the county or this particular place. And having our own control of the numbers so that we get them in the most timely fashion has allowed us to do that. And hopefully that's a part of why Team St. Clair has been successful in bringing our positivity down to 3.9 today and a 7-day rolling average of 5.5.
And I do want to assure everyone that the concerns that were brought up about us not having BJC results, we have always had BJC results in the St. Clair County numbers that we've reported, as have the state. They've just never been filtered down to each individual county. So, there was something that was brought to light. The state has been able to make that adjustment, so BJC numbers across the state are now being attributed to the county for the individual for where they live. But we have always counted BJC results in the numbers that we report for St. Clair County for EMA briefings.
So our numbers have always been 100% what you can count on.
Okay. The next one says, is it still necessary to sanitize groceries, newspapers, and mail?
So depending on your situation, if you have someone in your house that is immunocompromised, perhaps, on chemotherapy or something that would decrease their immune system, it's never a bad idea to wipe down any items that come from an outside source, just as an extra precaution, but it's not necessary.
Okay. And then the last one that came in says, how can we see the true numbers the state is providing to the counties?
So we get reports daily from the state, but the numbers that IDPH posts and that are out there are always available on their website, on IDPH's Department of Public Health website.
Okay. Thank you very much. Chairman Kern, a couple that come in here. The first person says, it appears from following social media, people are fed up with following the guidelines. What steps of enforcement are being taken?
So, first and foremost, businesses have really been, for the most part, very cooperative with this effort to reduce the spread. So many are requiring masks upon entering their particular business. They're requiring customers to social distance, to do all the right things to be able to control the spread. So that's really the place that enforcement starts, is at the front door of the particular business. Beyond that, the Sheriff's Department has been out, deputies are out, making sure that people are complying, establishments are complying, and largely they're going in, they're not doing gotcha stings or anything like that. They're going in and saying, hey, we noticed this, perhaps, or not perhaps, but we noticed this and you need to comply with this rule. They also are saying, hey, you're doing a great job. And we get reports back from the establishments that they have gone to, and many of the reports say they're doing a good job at this particular establishment. So they're out trying to help the situation, trying to inform. There are times when they go to a place and the owner says, we didn't really know that rule was in place. And so it's an informational dissemination that's going on, and if they go back and find out that perhaps the owner was not telling the truth when they said they didn't know, then there could be something a little more forceful, like a warning ticket. But so far, we've really been able to get through largely with just advising businesses on what to do.
Well, and I think we said it yesterday and have been saying it. None of us want businesses to close down. And for all those naysayers, there's some of them on here today, just, oh, it's fake, it's phony, it's that. Well, that's okay, that's your opinion. But as the chairman said, it's about compliance. And these numbers show that the mitigations that's been put in place has helped. And they're gonna continue to help. If we could get you to expend your energy on sitting here talking about the conspiracy theories and doing your part and join the Team St. Clair effort that everybody else has, we wouldn't be having these daily briefings every day, and you wouldn't have to sit here and stress yourself out. So that's my rant on you naysayers.
Well, and everyone saw that, watched the news. There was a bar owner that was in a county, not this county, and they got a ticket, and they said, I can do whatever I want, it's my right. But there are health department restrictions. You got to wash your hands. Is she saying that she doesn't have to wash her hands?
Sure.
There are rules that you have to follow. And during a pandemic, there may be additional rules that people don't like, but that's why we're getting to the metric of 3 days below 6.5%. And once we reach that, then we can expand the business operations, and that's what we're going to be working this week on, to be able to talk to the state and say, hey, look at our numbers, we keep these, here's how we document them. How about helping us out and allowing our businesses to be able to open up the way they were several weeks ago?
Well, and what gets me is you see these signs on some of the buildings, no shirt, no shoes, no services. Does that mean they let those people in? Just because it's been proven fact. The CDC had said the mask is important. So wear it. It's not that long. Doesn't take that hard to do. I hate wearing it. You hate wearing it, but we do it because it's the right thing to do for not just for us, but for whoever we're around. So go ahead.
Okay. The next person says, maybe you could explain to the bar and restaurant owners why they're still required to be outside. As of September 16th, the COVID-19 situational update per the IDPH has bars at 3.39% and restaurants at 4.97%. It's extremely low. Long-term care is 21.33% and assisted living is at 6.79%. This tells me it has nothing to do with the virus. Plus, casinos are allowed to be open and they aren't even on the graph. This is a joke. You need to let them open before they just go ahead and do it anyways.
So we're of the mindset that that now that we've reached this level below 6.5%, which is a benchmark that was set, that we need to reopen. I don't disagree. I think that certainly in St. Clair County, the large majority of our businesses did the right thing. They're requiring the social distancing. They're requiring the wearing of masks and the washing of hands. Sanitizing their premises and keeping of those logs. I think it all has worked. I mean, it's pretty clear. We see our numbers and they are headed in the right direction. They're headed lower. That isn't a coincidence. That just doesn't happen. That happens because people are following these guidelines. They're wearing masks, they're washing their hands, and they're watching their social distance. So that allows us then to reopen, and hopefully we can convince the state to be with us this week and do this, and then we'll be able to open up a little bit more. But until we get these numbers down to a significant level lower, we're still going to have to wear these masks and wash our hands. It was reported this morning that a vaccine is pretty far away. We had hoped, certainly everybody hopes it's going to be here as quickly as possible, but this morning there were a couple doctors on the news shows saying it's probably the second quarter, late second quarter of next year. Much as we don't want to hear that, at least there is light at the end of the tunnel. The tunnel may be a little bit longer than what we want, but certainly that light is there.
Okay, and the next one says, and you've kind of touched on this already, when will we know if all the work we've put in will pay off and the state will allow us to go back to phase 4?
So the work is paying off. To see the numbers, today our 7-day rolling average at 5.7%. It's really the lowest 7-day rolling average that we've had since this thing started. The work is paying off. And so now the rewards, I think, are coming. I think we're going to be able to open up a little bit more, at least to where we were in the middle of August. We're going to push for that. And so I want to thank Team St. Clair. Without you, we certainly wouldn't be where we are today. It's because people are doing what they're supposed to do. That's why those numbers are where they are.
Okay. Couple comments that came in, not really questions. One says, I hope other members of Team St. Clair appreciate the job that has been done. It's hard to imagine where we would be had Chairman Kern not kept these daily briefings going. And another person that said, you're doing an awesome job, 190 plus days.
It's been a lot of days. I know, you, Brian, Randy, the whole team, everybody is working hard, and there's a lot of behind-the-scenes work. You know, this doesn't just start at 3:30 every day. Sam gets to the office early and starts working on those numbers. And by the way, it's not just Sam, it's the whole health department. And it's from Barb, the director, all the way to everyone in that organization. And by the way, you got to remember, they're still doing all the things that a health department does. It's just they've added these duties on top of that. So I'm just so appreciative. We've got a great team, and it's really been it's been a hard effort, and there's a lot of road left to go. But I wouldn't be wanting to be traveling that road with any different team than Team St. Clair.
Well, and then the extended team of the citizens out there that have stepped up to the plate and have shared these messages every day and continue to practice what we've been telling them. They've had faith in what we're doing, and that's what we're saying. There's none of us that sit here. We've got tons of other work we do and more that can be done, but this is important. This was a pandemic. Whether you want to believe that or not, as we say all along. I mean, we were fortunate today, no deaths in our county here. And we want to keep it that way, and we can all work towards that. But it's a teamwork. It's a big team effort.
Okay. We're joined by Susan Sarfati, Regional Superintendent of Schools. As every Sunday, we always get questions that ask about the schools. And the first one here that came in today, a very important question. It says, with schools beginning their reopening plans, are there any suggestions you can give the parents on how to prepare their student for what's going to be different when they go back?
Sure. I think especially for younger students, or for younger children, have practice washing your hands and showing them how to do that and making sure they wash them for a long period of time, that 20 seconds. And if they have to sing the happy birthday song, something so that little children can wash their hands on their own correctly. The other thing is practice wearing a mask and tolerating the mask for a longer period of time, because it's a long day once they're in school and they have to wear the mask during the school day while they're inside.
Okay. And one other question that came in, it says, has Belleville High Schools reported any cases after they had their return to learn this week?
I have not been made aware of any cases that have come up in the Belleville schools. But remember that school districts are not required to report their COVID cases to me directly.
Okay. So it would be a school district decision on how publicly they make notifications outside of the contact tracing. If someone's identified, obviously they're contacted by the health department as being a close contact.
Correct, because it's reported by zip code, but a student who lives in a zip code may be going to a private school, may be going to the public school. And also, it's up to the school district on how they will report to parents when there's a case of COVID in their school or in a classroom. So each district will be doing that in a different way.
Okay. Well, thank you for joining us every week for these sessions.
You're welcome.
Director?
Very good. Thank you, Susan and Chairman and Sam. We appreciate that. The Sunday afternoon questions always brings a lot of good ones. Some of them or get answered over and over, but we get a lot of new followers every week, and so we appreciate that, and we try to answer them, and the ones that we can't that are coming in, we'll get you an answer to it. There's always the ones that we don't have the immediate answer to, but we'll try to research it and get you one. But what we want to leave you with today is that the numbers are looking good. We keep telling you that. I think we're past the Labor Day worry that we was worried about, and we're going to keep our fingers crossed on that still even further. And we continue to push forward. I know you've got some calls set up as early as tomorrow, hopefully arguing our numbers. And as we said, we know what we want to get done. It's just that we have to do it. We have to have all the right ammunition and all the right numbers and These numbers are the most accurate, as you heard Chairman Kern say, and that's what we're going by. So we're going to fight for the cause because we want businesses opened up. Nobody in the world wants businesses shut down, and we sympathize with all you business owners out there, the ones who have called, the ones who have sent messages. They're not ignored. We're doing the best we can, but we also have to do it in a sensible, safe way, and that's what we're here for. We'll be back with Daisy in just a few moments to translate this into our Spanish communities, and then we'll be back here tomorrow, hopefully with more news and lower numbers. Thank you.
Mask, gloves, soap, scrubs, TikTok, Grub, Hub, Twinks, Jocks, Bears, Cubs, Zoom is the new club. 6 feet, no hugs, still beat these mugs. Mask, gloves, soap, scrubs, mask, gloves, soap, scrubs, mask, gloves, soap, scrubs.
Mask, gloves, soap, scrubs, mask, gloves, soap, scrubs, mask, gloves, soap, scrubs, mask, gloves, soap, scrubs.
No school, gym closed, don't touch these clothes. Need food, this blows. Line at Trader Joe's. At home, gym, fish, don't come close. Just wave, wave, blow a kiss. Mask for mask, sis. Left, right, swiping on Tinder. What was life like? I can't remember. Needing my haircut, somebody shave her. Where is all of the toilet paper?
Gloves, soap, scrubs, mask, gloves, soap, scrubs.
Okay, dolls, y'all know what time it is. Come on, stay inside and lock the door. Stay inside and
Buenas tardes y gracias por acompañarnos una tarde más. Sam Bierman con el Departamento de Salud estuvo con nosotros hoy anunciando los números del condado y del estado. Tenemos 80,512 exámenes que se han conducido, con un incremento de 567 nuevos exámenes del día de ayer y 69,892 exámenes positivos, con un incremento de, 6,989 exámenes positivos, con un incremento de 22 nuevos casos de ayer, que incluye a hombres y mujeres en las edades de menos de 10 años a 60 años. 73,523 exámenes negativos y 184 muertes. 6,332 es el número de personas que obtuvieron un resultado positivo y que han completado los 10 días de aislamiento requeridos por el Departamento de Salud. En el condado hay 45 pacientes hospitalizados por problemas relacionados con COVID-19 y 3 de ellos en ventiladores. En la región hay 76 hospitalizados y 7 de ellos en ventiladores. Hoy no reportamos ningún cambio en el número de casos en las instalaciones de cuidado a largo plazo en el condado, y los números estatales son de 5,105,153 exámenes que se han conducido en el estado, 274,258 exámenes positivos, con un incremento de 1,402 del día de ayer, y 8,450 muertes, que tristemente incluye 14 nuevas muertes en el estado. Mark Hearn, el director del condado, estuvo con nosotros hoy anunciando el número de casos por código postal, y hoy solo voy a dar los que tuvieron cambio. En 62201 tenemos 235, en 62204 tenemos 138, en 62205 tenemos 198, en 62207 tenemos 243, en 62208 tenemos 420, en 62220 tenemos 555, en 62221 tenemos 660, en 62223 tenemos 408, en 62226 tenemos 719, en 62239 tenemos 100, en 62243 tenemos 107, en 62254 tenemos 258 y en 62269 tenemos 546. Y hoy tuvimos la sesión de preguntas. Yo nomás le voy a dar 3 de las preguntas que hicieron el público. La primera es: ¿todavía es necesario desinfectar el mandado, el correo, etcétera? Y al menos que alguien en su casa tenga problemas de salud, no es necesario, pero también no es mala idea. Segunda pregunta es, dice: mi hija que estaba en el colegio tuvo COVID-19. Si yo compartí una bebida con ella y estuve mucho tiempo con ella, yo no me contagié, ni mi esposo, ni su novio, ni su compañera de cuarto. La respuesta a eso fue que puede ser que en el tiempo que pasaron juntas o juntos, ella no estaba contagiosa, o su sistema de uno fue más fuerte y combatió el virus antes de que se pudiera contagiar y presentara síntomas. Y última pregunta fue: ¿cómo podemos prepararnos como padres, ya que nuestros hijos pueden regresar a la escuela muy pronto? Y la respuesta fue hablar mucho con ellos y enseñarles cómo lavarse muy bien las manos y dejarse el cubrebocas puesto por un largo periodo de tiempo, especialmente para los niños más pequeños. Y finalmente, Herb Simmons nos comentó que estamos a 7.5% de casos positivos en la región, y en el condado estamos a 3.9%. Esto y nos vemos mañana.